Now before starting with any procedure, always remember to sanitize your hands first. Good morning. Today we are going to do a breast examination of one of my patient named Lorelai. So let's start with it. At first, I'm gonna explain her about all the procedure step by step, and by taking her consent, we'll move forward. I'm gonna ask her to undress till her waist and then cover herself with blanket. And I'm gonna ask her to sit upright with her hands relaxed or keeping her hands on her thighs. And I'm gonna ask her to uncover her breast. Then we'll see if there's any obvious mass, swelling, any kind of skin changes or asymmetry of the breast. Now the next moving on to the general inspection, I'm going to ask patient to place her hands on her hips and just push inwards, just so we can see the movement of pectoralis major muscle, and if there is any movement in breast mass, then we'll be able to observe it. And now moving towards general inspection, I'm going to ask my patient Lorelai to put her hands on her waist and just pull inwards, just so I can, if pectoralis major moves, I can see if there is any mass in the breasts. Now moving to the next general inspection, I'll ask my patient to place both of her hands at the back of her head, and then we'll see if there is any mass located or any movement in the breast tissue. Similarly, in the same position, I'm gonna ask her to lean forward, just so if I can see if there is any movement in the mass if present in the breast. Now we are gonna move forward with the palpation. Make sure your hands are gentle and warm, and make sure your patient is comfortable with you so that she can lie down and put her hands on the back of the head. Starting with the examination of nipple, we'll see by squeezing if there is any discharge, and if there is any discharge, then we check the color, order, consistency of the discharge. Now moving on to the breast examination, we are going to take a systematic approach. There are certain methods like clock face method, spiral method, vertical strips method, and pie method. Here we are going to proceed with spiral method. Now we move forward with the breast and nipple palpation to see any kind of mass or any discharge. So firstly, we will start with the nipple palpation or squeezing of the nipple. So just like using your hand and just try to squeeze the nipple area to see any kind of discharge. Notice where if there is any color, order, or a consistency of the discharge. Now we'll do the palpation of the breast. For doing the palpation of the breast, use your palm and use your fingers and finger pads and just palpate around the nipple area, certainly like this. Now if the mass is palpated, then we are going to check the position, size, shape, consistency, mobility, fluctuations, and skin changes if there's any. Now moving next to the examination of axilla. We are gonna palpate axilla with free hand. We are gonna see and palpate the lateral borders, medial, anterior, posterior, and the apex. We have to check and palpate on the both sides of the arm. Moving on forward, now we'll palpate the axilla area to see any kind of mass or disformity. So firstly we'll start with the anterior wall and we'll palpate it like this. Then the posterior wall, moving on to the medial wall, and then lateral wall, and the axilla, apex, and now the apex. Now moving on to the last part of examination, where we will examine and palpate the lymph nodes, namely cervical, supraclavicular, infraclavicular, and parasternal. Now we'll move towards the next breast examination, next part of the breast examination, in which we will palpate the lymph nodes. So starting with the clavicular, with the cervical, similarly like this, and then supraclavicular, infraclavicular, and parasternal. Now moving on to the conclusion, I'm gonna ask her to cover herself with a blanket, explain her all the findings, answer all her questions and queries, and thank her for cooperating.